Good afternoon. My name is Jill Oliveira. I'm the Public Information Officer with the Minnesota Bureau of Criminal Apprehension. Thank you for joining us today here in Bemidji or online. This morning you'll hear from BCA Special Agent in Charge Sue Burgraff, Beltrami County Sheriff Phil Hodap, James Madigan from Minnesota Adult and Teen Challenge, and Office of Justice Programs Statewide Gang and Drug Coordinator Brian Marquardt. Each will make a statement, and afterward we'll have time to take some of your questions. We'll begin with BCA Special Agent in Charge Sue Burgraff.
Good afternoon. I am Bureau of Criminal Apprehension Special Agent in Charge Sue Burgraff. We're here today because people are dying and we need your help to try and stop it. Over the past few weeks, several northern Minnesota communities have seen suspected cluster heroin overdoses. These are groups of overdoses in a small area in a small time frame. We've identified recent overdoses in Virginia, Cass Lake, Mille Lacs County, Beltrami County, Red Lake, Bemidji, Detroit Lakes, Moorhead, Dilworth, Marble, Hibbing, and more. Some of these communities have seen multiple overdoses. In many cases, first responders have successfully treated victims with Narcan. But 7 people have died, and we suspect there are more. We believe that in some of these cases, heroin was laced with additional narcotics, making them even more deadly. The Bureau of Criminal Apprehension is reaching out to Minnesota law enforcement through the Minnesota Fusion Center to gather information about these overdoses and the deaths in their jurisdictions so that we can better understand the breadth of this rash of overdoses. BCA narcotics agents are working with local law enforcement agencies to try to identify the sources of these drugs. BCA agents and our partner agencies are conducting criminal investigations into each of these cases. We're treating these overdose deaths as homicide investigations, and when we find those drug dealers, we intend to charge them with third-degree murder. Dismissing heroin as a big city issue or that of a longtime drug user is a big mistake. We see heroin in every economic background and every type of community. This is a problem that is getting worse, and with today's more pure heroin, getting deadlier.
Good afternoon. My name is Phil Hodap. I'm the Beltrami County Sheriff. And I'm just here to talk about the issue from the perspective of local law enforcement. We're very proud here in Beltrami County and in the city of Bemidji to work very closely with our law enforcement partners, both tribal law enforcement officers and our federal partners and our state partners with the Bureau of Criminal Apprehension and the state troopers to try and stop the flood of drugs to our area and to work with the public to try and solve the problem of the drug influx into our community. We've seen this rash of heroin that's come into our area, and we're working hard to try and reduce this terrible epidemic, I guess I'd call it, that's struck the Beltrami County area and the region, and we need some help from the public to address this problem. We are working hard to try and determine who the people are that are bringing these drugs into our area. We actually have identified several of the people, and it's our intention to charge these crimes out if we're able to develop enough information to make chargeable cases. Now, we do need help from the public to get information regarding the people who are involved in trafficking narcotics in this area. So please do not hesitate to call us, contact the task forces in this area. Our number here is 218-333-9111 at the Law Enforcement Center. Please ask for the Drug Task Force and you'll be connected right away. Know that our law enforcement officers are working diligently to stem this flow of narcotics trafficking in the area. And we aren't going to stop until we do that. Thank you very much.
Good afternoon. I am James Madigan, the Community Outreach Representative for the Central Minnesota Adult and Teen Challenge up in Brainerd. Teen Challenge has a pretty wide array of programs statewide, all the way down in Rochester, all the way up to Duluth, and then in Minneapolis and Brainerd as well. Mainly what we do is we're a long-term faith-based treatment program, but we have licensed programs across the state. We work with teenagers and adults. And the heroin epidemic, which it's been called, which I completely agree with, is something that we've been seeing, on a daily basis for a few years now. I looked at some numbers this morning as I was walking out of my office, and in 2010, 4% of our clients were in there for heroin use. And that's not to exclude, opiate pain pills, and other kinds of opioids out there. So about 4%. And then today I looked at our actual clients that are in the program currently, and it was 30% of them are in there for heroin use. And then on top of that is the opiate pain meds and all the other painkillers that are included as well. So, the numbers don't lie. Something is definitely changing. What we noticed is about 50% of these people that are on the heroin now reported that they started with prescription pain meds. And not only did they start with prescription pain meds, but 32% of those were high school students the first time they tried it. So these people were under 18 years old when they first got their hands on opiates. And then what we noticed is the pain pills are hard to find and they're expensive. And so now there's all this cheap heroin being flooded into, central Minnesota and northern Minnesota, and that's what they're all gravitating towards. And this stuff is potent and deadly. And you don't know from one day to the next what the potency is going to be. So one day you can do this much and be fine, and the next day you do the same amount, and all of a sudden your respiratory system's being affected and you end up overdosing. Teen Challenge, like I said, has a wide array of programs, and we want to be a resource. A long-term faith-based program isn't always, what someone needs, and that's why we have some outpatient and some short-term, and Teen Challenge isn't always a fit. But we can definitely point you in the right direction and get you some ways to find help for someone you know. So do not hesitate to give us a call, contact county social services. If you or a family member or a coworker that you know of is dealing with addiction, especially this opiate addiction, don't hesitate to reach out for some help. And it's out there, so give us a call, go to our website, or touch base with social services. Thank you.
Good afternoon. My name is Brian Marcourt. I'm the Office of Justice Programs, statewide gang and drug coordinator. Our violent crime enforcement teams are partially funded through our office. They encompass over 70 counties in this state. Have over 200 investigators focusing on drug and violent crime. They are partnerships between local law enforcement, tribal law enforcement, state and federal government to go after these types of crimes. As you've heard from Sheriff Hodap, local law enforcement, BCA, and all of these agencies are taking these cases very seriously. Drugs are killing people across our communities. It's one of the biggest burdens on society, on our adults, and especially on our children within our towns. We have to come together to report the drugs on the street so we can get them out of the hands of the dealers. If you or a loved one is facing the addiction, such as Teen Challenge is a program that you need to get your family member, your loved one, or you into that program. Law enforcement is going to aggressively investigate the sources of the heroin being brought into these communities that are causing these deaths. Responding to overdose investigations, treating them as crime scenes, as Special Agent in Charge Burgraff indicated, vigorously prosecuting these individuals when we can locate them for murder. Obtaining additional samples of the heroin to determine if any other substances have been put in to the heroin. Heroin purity levels in this state are as high than anywhere across the country. Adding to that the possibility that other substances have been placed in or mixed with them, such as fentanyl or morphine or some other substance, only compounds the problem. Encouraging the use of Narcan for use by first responders and others can help prevent some of these overdose deaths. Conducting community forums to educate the public and provide information. Getting as much information out to all of you is one of the values that the violent crime enforcement teams can do. Developing partnerships between law enforcement, treatment, public health, and the medical community to address all of these issues is a priority of all of the law enforcement and people that are standing before you today. Our office also keeps stats from all of the violent crime enforcement teams. In 2015, I just reviewed it, we had 18 pounds of heroin seized across this state. It is not just a Bemidji problem, it is not just a Duluth problem, it is not just a Minneapolis metro problem. It is across this state. We have seen increases continuing the last 3 years, and that 18 pounds is the equivalent of approximately 82,000 doses of heroin being taken off the street. We're pleased with that number, that we're able to find and get that amount of drugs off the street, but we will not rest until we can eradicate and take all of the heroin that we can find off the street to protect our communities. One death, one overdose is too many. North Central Minnesota, the 5 violent crime enforcement teams accounted for approximately 40% of the heroin. That's covering the upper third of Minnesota. But that is not just a northern Minnesota problem. It doesn't matter if you're in a small rural community or if you're in the Minneapolis, St. Paul metropolitan area. It doesn't matter what walk of life you come from. Heroin will affect your family on one use. Don't let it be you. Thank you, and we'll open it up for questions at this time.
That 18 pounds that you mentioned, what's that equate to in a dollar amount, so to give people some perspective? Is there any type of way we can quantify that?
I don't have those numbers available. It's all depending upon the location in the state where those are taken, depending upon the value of it.
Are we talking thousands, millions, or is there any ballpark that we're talking about how much stuff has been taken off the streets?
I guess I would defer to somebody from local if here where.
It would depend on how much it was cut with.
Right.
And all that kind of stuff too.
It would be a million plus on the easy.
The purity of it.
Yeah, depending upon what it's cut with or the purity level, we could be talking $1 million
Or more.
or more.
You know, if the purity was
Oh, go
higher.
ahead.
There's been a lot of talk about getting the public involved And of course, when the public has eyes, they can see people. With meth, you know, we were told, and it's true, that the skin becomes pale, the teeth rot out. But if someone's shooting up heroin or using heroin, is there any kind of change as far as the look of their face or their skin color or anything like that that can tip you off that maybe something is going on?
From what we've seen with heroin addicts coming in, there's dark circles under the eyes, paleness, you know, not much with the dental at all like the meth, but there's just an overall, you know, unhealthy look to them. And then really where you can get to see is if people are wearing long sleeve shirts in the middle of the summer, you know, taking extra lengths to cover up their arms and stuff, to cover up track marks and stuff. So, you know, that's some of the first stuff to look for.
Can you expand a little bit on, you said this is affecting every demographic, every economic class. Can you expand a little bit on where we're seeing this and who are the greatest affected, or I don't know, where the efforts are being most concentrated?
It's being concentrated in all 87 counties of this state. Approximately 40% of the 18 pounds I talked about were coming from the northern third or so of Minnesota. But it doesn't matter, we're seeing overdose and heroin cases in very small towns, in very rural places of this state, and we are seeing cases in downtown Minneapolis, downtown St. Paul. It doesn't matter what walk of life you come from or where you live, you could be affected.
There was mention of this being possibly one very powerful batch. Do you guys have any idea where this specific heroin is coming from?
At this time, that's what the investigation and testing will show, whether there's any similarities between any of these substances in the most recent heroin overdoses. A vast majority of the heroin seized by the violent crime enforcement teams has been coming out of Detroit, Chicago, and transported into the state of Minnesota.
Is it predominantly brown heroin or white heroin? What does it look like?
So there has been a variety of substance, whether it be white, brown, or black tar heroin, but the vast majority of the heroin that we are seizing is a brown substance.
People are always a little nervous about getting involved, especially something like this. I heard a conversation the other day in a grocery store that people seem to be talking about this type of thing, and the thing was, well, what are we going to do? We don't really want to get involved, but so if someone really suspects something is going on with an individual or a household in their block, what do they need to do as far as just practically getting you the information, and that information, where will it go from there? And would they ever be identified, that thing?
Well, they can talk with their, when you're asking about what the things are that they can do, they can talk with their family and friends about the drug and really just how dangerous that it is. If they have information about drug sources, they do need to get in contact with law enforcement. Now, it depends on, you know, what would happen with that information. Sometimes that information is kept confidential. Sometimes we do use it as probable cause on search warrants. It just really does depend on, you know, what we're doing in the investigation. But I also want to stress, you know, asking about what people can do about it is also, if you are using heroin, or, you know, who may be watching this today is using heroin, get help. Reach out to family, reach out to friends. There are many programs like Teen Challenge that are out there, and we really want to urge people to get help for this. We just need to get people to recognize that this is a real problem. Nobody is immune. No social economic group or community is immune to this, and we really must all be vigilant about this. Yes.
If I may, I'm Joe Venny, Chair of the Beltrami County Board of Commissioners. And boards of county commissioners act as county boards of health. I think another vehicle, another artery that the public should be aware of, that we work and interface with law enforcement, which is our public health departments. So work through our departments of public health, directors of public health. It's immediately accessible right over here in our Health and Human Services building. So let's call upon that as a resource that can educate the public and that is in direct partnership with law enforcement in this epidemic. Thank you.
Yeah. Yes.
You had mentioned that there were a few people that were suspected of basically bringing in the heroin. Does this have anything to do with the recent heroin drug bust in Itasca County? There were 3 guys that were arrested for bringing in heroin down there. Is that connected?
That's just heroin from one area that's brought in. We are not necessarily saying that is connected to the Bemidji-Beltrami area at all. I think we have multiple sources that are bringing heroin into the northern Minnesota area. And we really need to do further testing through our laboratory, as well as we need to get the tox results on a lot of these fatal overdoses too, to exactly see, what we're dealing with on the heroin. Are we dealing with a more just pure form of heroin, or are we dealing with heroin that's laced with fentanyl or some other type of narcotic?
But with the suspects you have, are they in custody, or are they just sort of groups of people you're looking at right now?
Well, recently with the arrest in Itasca, there are individuals that are currently in custody. There are others that are in custody too on other investigations. Yes.
Addressing the statistic you said about at least half of people say that they're using the drug. It starts with legally prescribed pain pills, and a lot of these are kids under 18. Is there anything parents should be looking out for if their kids have had pain problems or are prescribed pills? Is there anything that we should be looking at proactively before it gets to the heroin level that parents should be cautious of?
I think with the pain meds, a lot of times they're accessing those just through the family medicine cabinet. A family member may have had, a broken arm or some issue at some point, and they've left the pills, in the medicine cabinet. Just get rid of any pills once you're done using them. You can drop them off at most police departments. They have a drop box. You can go there, drop them in. Whatever you need to do, get rid of the pills. Don't leave them laying around. Most of the time, it is kids will actually be prescribed them and then end up abusing them. So watch for them taking more than prescribed. The pills not lasting the length of time they were supposed to. Stuff like that.
One more question.
Narcan was mentioned about life-saving measures. Is that being looked at as being expanded? I know you still need a prescription for it here in town. First responders, or some places it's been in schools, other people, bike cops. Is this being looked at as something that we want to be expanded?
Yeah, would you like to talk a little bit about Red Light?
My name is Kelly Brunell. I'm the Senior Criminal Investigator for the Red Lake Department of Public Safety. This is Narcan. All of our police officers are issued these Narcan kits. These Narcan kits have saved a lot of lives on the Red Lake Reservation. They're very simple to use. Basically, pull it apart. Talk.
You are ready to use pull off red safety guard.
Pull off the red safety guard and you inject it into mostly into the thigh. Like I said, Red Lake we recently got a grant from to carry these for our law enforcement and our conservation officers. We haven't had a death within the past year from heroin overdose, but I guarantee you we have saved, and I'm just going by memory, but I believe it was 19 times this was used since January of this year. And some of these people are, upon the officer's arrival, are non-responsive, non-breathing, no heartbeat. We've had officers actually take individuals out of a car, and we're doing CPR when the ambulance arrived, and they were able to administer Narcan. So that's what got us, to get the Narcan for the officers. So.
Is this looked at it for other departments besides Red Lake?
Mike LaRock, I'm the Director of Public Safety, Chief of Police for White Earth Nation. Right now, our public health and our IHS department is currently working with the communities and the community councils in the area. We have about 5 or 6, maybe 7 main communities on White Earth Nation. And our public health and our IHS doctors are working with the community members to get them educated in the Narcan. They are going to be issuing Narcan to some of the community members in some of the communities once they're trained in the Narcan stuff. So that's where White Earth is at right now with Narcan. So, thank you.
Thank you, everyone. If you have additional questions, we can answer them afterward.